Good morning, good afternoon, and good evening to all of you, wherever you're joining us from. And welcome to this regional workshop for Latin America, which is focused on school health and NCDs. And today we'll be particularly concerned with management and control of NCDs and school health. First of all, just a friendly reminder that we have a translation or interpretation available to all of you. There will be an interpretation to Spanish, Portuguese, and English. And most of the event will be spoken in Spanish, but there will be parts of in English. And as you can see here on the slide, there is an interpretation button in the bottom of your screen that you can press and then choose the language that you prefer. My name is Marie Haverslev and I'm the chair of NCD Child. And today's workshop is presented by NCD Child, which is a global multi-stakeholder coalition championing the rights and needs of children, adolescents, and young people who are living with or at risk of non-communicable diseases. Yesterday, we focused on prevention of NCDs, and today we'll be focusing more on control, and that is really within the scope of NCD Child to aim to grasp both of those parts of the NCD agenda. Our secretariat is based at the Center for Global Child Health at the Hospital for Sick Children, also known as Sick Kids, and we have the great support of our secretariat here today through some of the many people behind the scenes. Just go quickly to say thank you to our financial partner, which is the Young Health Program from AstraZeneca, for their ongoing support, and as well a huge thank you to our partners for this workshop, CLAS and the American Heart Association. Without you, it would not have been the same, and we really have had the opportunity to establish a very good collaboration and really zooming in on the Latin American region with your support. So thanks again for that. Now onto the agenda. First of all, we'll just have opening remarks and a summary of day one, and then we'll move into our keynote speaker, Didier Jourdain from UNESCO, and then followed by a plenary panel and a Q&A session. And in this panel, you'll find that there will be a breadth of expertise and different perspectives, which is something that's very important to us at these events, to bring in different stakeholders and hopefully new perspectives or new knowledge to the ones of you that are participating. And there will be this opportunity to ask questions in the end. And finally, we'll just have closing remarks. And again, today it will be followed by a breakout sessions. And everyone who's here with us now is invited to join us for those, and we'll be sending a link to you all with the opportunity to join these sessions, where we really want that participatory feeling and create an environment to also hear from all of you that are not in the formal program today and learn from your expertise and your experience. So that would be excellent if you could join us. And then before we begin, just a few housekeeping items. As I said earlier, English and Portuguese interpretation will be available for the Spanish parts, and there will also be interpretation into Spanish. If you are able to, please do mute yourself. This webinar will be recorded, and you will also be able to share this link with colleagues or others after the event is complete, and we will be sharing that with you, or in case you want to revisit something that was said at a later point in time. And Of course, we'd love to hear your comments and questions. So if you have any, then please do use the Q&A function to submit these questions, and we'll try to address all of the questions in the time permitting or following today's webinar. With that, I'd like to hand over to my partner in crime, Beatriz from class.
Hola, buenos días. Es un placer estar acá como socia en el crimen, dice.
Hello, good morning. What a pleasure to be here as a partner in crime. As my colleague said, first of all, I'd like to thank all those who participated in day number 1 of this event. I would like to make a short summary. Obviously, there were many important subjects that were dealt with, and this is not going to be enough, but I would like to mention, yes, 4 points in particular. First of all, the day was fantastic in many ways, but one way was the active participation of youth of our region. They were moderator, panelists, they participated mostly in the discussion groups. And I would like to mention specifically the Alianza Juvenil, Youth Alliance for Health and Development, which is the entity that together with HLAC organizes this event. Secondly, it seemed to me very important to hear about the concept of schools as doors of entry for children and youth, and that this makes for all the schools to be promoters of health. It was also mentioned, though, that not everybody has the same opportunities. There are many vulnerabilities, and children are not an island. They're in a social, economic environment that affects them. So therefore, it's important to understand that in spite of the fact that we would like all the schools to promote health, this unfortunately requires a lot of effort still to be able to reach that. Certain principles were mentioned as well, the inclusion and equity principles, among others, and a wholesome focus around schools, that is to say, all the school, including the kiosk that sells food, physical activities, the whole environment is an educational one. It has to be done with a whole school approach. The leadership of this school sector was mentioned as well. The leadership has to respond to the context in which schools, children, and youth are located. And what was also said was that we have to listen the voices of children and youth directly. Sometimes it was said we listen to experts, we listen to many people that do not have a direct experience concerning schools. And the main theme that was mentioned was how the food industry, unhealthy food industry, and tobacco and other products tend to see youth and children as their target population. And they target their messages to these groups. Melin from Panama, a young woman from Panama, was telling us how publicity, advertisement is important for the youth, and advertisement therefore must be regulated. And we know that there have been ads, rather that there have been movements that indicate that no ads should be targeting children and youth. This is my summary concerning yesterday, which, as I said, was a fantastic day, and I'm deeply grateful for that. Now, what I would like to talk about is about today, day number 2. Here we're going to talk about controlling NCDs in children and adolescents through schools. In order to be able to reach the right of education for all, we have to consider in particular children and youth that have chronic diseases and have to manage them. We must also, in particular, underline the interruption we have with education and the possibility of improving health in schools, and all of this through COVID-19. This is a challenge we have never had before. So this will all be part of today's conversation. I would now like to introduce to you Edilaine Braga, one of the young women of the Youth Alliance from Brazil, who will introduce our keynote speaker. Please, Edilaine. Thank you very much, Beatriz, and good afternoon, everybody. First of all, I'd like to thank you for having invited me and for the honor to be able to introduce to you Professor Didier Jourdan, who is in charge of the chair of UNESCO. The interpreter apologizes. Madame Edilaine is muted.
Hola.
Hello?
Yes.
Yes.
¿Me escucha?
Can you hear me?
Sí.
Yes.
Bueno, voy a
Okay, I'm going to introduce to you Professor Didier Jourdan, who, as I was saying, is the UNESCO chair in global health and education, and he heads the WHO Collaborating Center for Research in Education and Health. He is also the Dean of the Faculty of Education at the University Blaise Pascal in France, and he is also director of the promotion of health in public health in France. He's a very big specialist in public health. Please, Professor Didier.
Thank you so much, Edilaine. Thanks a lot to all of you. Thanks to give me the opportunity to share the vision of the UNESCO chair and WHO Collaborating Center in global health and education. We're going to talk for the next 20 minutes about the question of the strategies for management of NCDs and educational continuity for children with a chronic condition during the COVID-19 pandemic. I just would like to share with you 5 ideas during this 20 minutes. The first of one is the question of the framework for the return to school for children and young people with NCDs. The second is to learn from the field. What do we know? Of course, we are far from the perfect world. A lot remains to be done in schools. So we need to learn from the field. Then we will go back to the school perspective on the question of students with NCDs. And then the second part of my talk will be focused on the levers to change, how to move forward. And I will conclude with the specific role of the healthcare professional. So concerning the framework for the return to school for children and young people with NCDs, first of all, I would like to say that this webinar is timely because, you know, researchers and a lot of people are more and more aware that we are not facing a pandemic, but a syndemic. It's not only the question of fighting about the virus. It's a very complicated interaction of intertwined different factors that are linked, of course, to the epidemic itself, but also to the social factors and to the NCDs. You know, it's not only talking about comorbidities, it's talking about interaction between an infectious disease, NCDs, and social factors. And then it adds to help us to think health differently. We have to change from a paradigm to another. So if I'm back to basic, of course, all of you here already know that children with chronic illness have to be in schools. They have the same needs as other children. You know that living with asthma, type 1 diabetes, juvenile arthritis, mental health issues does not make you a different person. You cannot limit children with NCDs to their NCDs. They are children, they are young people that need socialization, they need learning, they need to live in a positive environment, an environment which has a positive impact on their development, which is most of the schools, the link with the peers, the link with the adults. And I'm sure that we share that denying school to those who need it most to succeed, and especially young people with NCDs, is just a social disaster. So clearly, we have to organize everything for these kids to be in school. But of course, we need a framework because it's not evident. And in the work we did with Nicola Gray and Janet McDonough, we identified 3 kinds of situation talking about the management of the situation. The first one is, of course, we have children and young people at very serious risk because of issues linked to the immune system or to lung disease, and these kids have to be shielded. And we now have more and more tools for blended learning, for telemedicine, but of course it's not a panacea. But this is something we can use to maintain the links and to also use that with other kinds of homeschooling, for example. But these are a very limited number of children living with chronic condition. Most of them, and this is the second category, have well-controlled syndromes, and then they will benefit to stay in schools. And unfortunately, we observe that in many countries, people are afraid with that, and they are refusing children and young people with NCDs to come back to schools. And of course, there's no reasons for that. And of course, there's a third category, especially with young people and some adolescents with whom the symptoms are not really controlled. And for them, there is a need for the adjustment of the care plan. But knowing that, we cannot consider that by definition, all the kids with chronic conditions are vulnerable, that have to be hidden in their rooms at home. We need to have a more in-depth analysis of their situation. Of course, you can say that's a good idea, but now the point is, if we want to have the kids in schools, and if we want to make school just like Beatrix, just say spaces for health promotion, how could we do that? So now I would like to come back to the real world, because you all know that if we just have to publish guidelines and that by definition they will be implemented in the field, we would know that. You know, it exists. It exists in the world of the care bears, where everything love each other, where life is so good and everything is pink. But sorry to say, we are not living in this world. This is just a dream. In our world, the question of inclusion of students with NCDs, the question of the COVID-19 are not top priorities. First of all, because we have other medical priorities, such as other kind of infectious diseases, such as issues linked to parasites, to malaria, to worms, that are clearly important. You know, some countries just didn't close the school and do not develop any framework because they have so much other kind of priority issues. The second reason is that we also have a lot of issues in relationship to health with the school facilities. Think at ventilation. If you cannot open the windows of the room because you have mosquitoes entering, how could you ventilate it enough to limit the propagation of the virus? And it's the same for the access to clean water to wash the hand. So we have many other issues. And as you know, in many countries in Latin America, and this is the case everywhere, we miss school nurses, we miss school doctors. So these two things together means that we cannot consider that one size fits all. We are in a situation where, depending on the countries, depending on the situation, the regions, we will have different ways to manage NCDs during the COVID-19. We did a survey within the community of the UNESCO chair in 42 countries. And I just would like to share you few ideas on what we learned from the people in the field. When we talk about this question of the guidelines and the management of the COVID-19 crisis in schools, what we observe in at the global level is that most of the guidance is only limited to hygiene measures, nothing about education. And when we ask the people in the field, they are in trouble because schools, it's not only managing the distance, it's also teaching, it's also educating the students. First thing we learn from the field. The second is that when you don't have a good cooperation between the stakeholders, it is extremely difficult to reopen the schools in good conditions, and especially to have the children with NCDs. First, and it was an incredible surprise. Perhaps you won't be surprised, but we were. None, very few in fact, none of the responders in the data we gathered never ever mentioned the local health providers. Nobody never talk about the GPs, the nurses, the pharmacists. Do you realize that we are living on a planet where you have a big health issue in schools, but the cooperation with the health professional at the local level is extremely limited, at least in our survey. Perhaps we missed things, but this is an issue. This is something we have to think of. The fourth idea we learn is the question of inequalities. All the people say that it increases the inequalities, and they were very worried about that. Of course, depending on the country, the resources are, of course, missing. In many, many countries, people do not have masks or enough soap for the children. So what is extremely important at this stage is to realize that we are living in different conditions, but what is clearly missing is the cooperation between the different actors around the students. Of course, you also know that there's a lot of different experience. People living the crisis, and especially the students with NCDs, their parents and the teachers who have to have them in schools are very often in difficulties, increasing the stress level, trying to find new practices, a lot to do in that field. My third idea is then to back to basics. We have in mind that the priority is to have children and young people with NCDs in schools. We see that it's pretty difficult. One of the reasons, and again, this is what Beatrix said in the summary of yesterday's talks, is that we have to think not only through the glasses, I would say, of the family, of the children and young people, of the medical doctors, of the state, but we have to use the glasses of school, the glasses of school systems, if we want to be able to manage in a good way this question of the children and young people with chronic conditions in school. We need to think of what it means for school using the language of a school. So from the educational point of view, the first thing linked to chronic condition is that it is a major form of discrimination. So for schools, it's a question of inclusion. But it's not only that, it's also a question of teaching and learning, because schools have the responsibilities to enable all students, including those with NCDs, to develop skills for self-fulfillment as individuals, but also to live in communities. And finally, education in the field of health, living with people having a chronic condition. And for these people, health literacy is absolutely critical. So we have to have in mind that thinking through the lens of the school systems is thinking of inclusion, equity, and citizenship. So it's not only protection, it's protection together with education. It's not only, and in every country you have healthcare plans, this is the French version, but you have that in many countries, but organize the everyday life. But we also need to create the condition for an efficient education and to give the means to all children and young people with NCDs to succeed. It's a question of equity. So how to do that? What kind of lever do we have in our hands to contribute to a positive change in this context of the COVID-19 crisis for children and young people with chronic diseases? First of all, we have to forget that we could find a magic wand. There's no magic wand. We have to think at all the determinants of the school policies and practices in a way which is not implementing a policy, but an improvement. You know that what happens in Caracas and in the rural regions of Bolivia is totally different. So we cannot imagine implementing something in these two countries, but we could try to improve in every school the way in which we are schooling children with NCDs. To do that, we have to think clearly of what's important if we want to introduce change in the school systems. There are 4 different levers. One is the policies. We need policies that encourage inclusion of children with NCDs, but it's not enough. We also need structures and systems. It means the organization, the facilities to make it possible, but it's not enough. You need to have relevant practices. We have to talk of health promoting practices. The practices of headmasters, teachers, and all the people involved have to be health promoting for children with chronic diseases that help them to live with their condition and to be free in a vision of emancipation from this condition. Again, a chronic condition does not define the young people. Young people are people in development, and the chronic condition is only one of the determinants of their future life. And then, of course, we have to think of the human resources. Without relevant training, without relevant recruitment, it's going to be difficult. So if you come back to the data, the evidence-based data, moving forward in terms of schooling of children and young people with chronic diseases, have to let us to think simultaneously on policies, structures, and system practices and human resources. And if I summarize what we need to do is, first of all, as I already said, to promote intersectoral approach, because there's always social dimensions and health dimensions embedded with the educational dimension for children and young people with chronic diseases. It's also, of course, the genuine involvement of the young people. Young people are able, they are the best specialists of their own diseases. And we need to change the vision we have. Intersectoral approach, genuine involvement. But to do that, we need to have extremely strong advocacy strategies. You know, if it's only trying to change things at the local level, it's important, but we also need to contribute to social change at a global level. And this is one of the missions, of course, of NCD Child. And finally, of course, the key question of the development of the capacities of the education professional is absolutely critical. Yes, and this is why I use this photo, we have to build bridges between the people, between the young people and the professionals, between healthcare professionals, social professionals, and education professionals. And of course, it has to be very concrete. You have here a table, you will have the presentation if you want, but just to say, if you think of diabetes, having kids in schools, for example, in primary school with type 1 diabetes, need to have policies for these people having this long-term condition, but also on urgent care, depending on what happened with, if they are in hypoglycemia and all that stuff. The second is to have structures and clean spaces and places where they can receive the medicines and the treatments they need, and also the communication, the explanation. You know, the experience of children with young people in schools is very often linked to people do not understand what's my life and what I need, and they talk about their peers, but also the professionals. This is part of the organization of the schools. This is also, of course, human resources and diabetes awareness among the professionals, and then the practices that have to be concrete, not only, again, hygienic and medical practices, but also educational practices. I would like just now to be more concrete and focus on teachers. Why teachers? Because you know this is the majority of the education professionals. Of course, we have other professionals, especially in masters, health professional, social professional in schools, but how could we move forward with the teachers in the different countries in South America? First of all, I don't think we have to, be in a kind of a moral posture experience. You have to do that just because it's extremely difficult to take together all the tension and the pressures of the teaching activity at the time. But what research told us is that if you want to understand what could lead an education professional to be able to, contribute to inclusion and equity for children and young people with NCDs, we have to know that it's not only a question of guidelines and circulars and laws and institutional factors. All the surveys demonstrate that it's mostly linked to personal factor. The vision they have of their role, a question of vision of their professional identity. Why am I paid for? This is also linked to the students themselves and the knowing they have and the context. But it's not only that. Research shows that what drives the professional activity of the teachers is also their impact on students. There's also the impact on themselves. You know, it's hard to survive, I would say, every day and in an entire career if you are a teacher. You need to have rewards. And we have to shape inclusion as something that is rewarding for the teachers. And of course, the parents, the community, don't forget that, of course, an important part of the parents are not in favor of the inclusion. If we want to move forward, we have to forget that guidelines are enough. It's more personal factors and factors linked to the community. And you know, research shows that for teachers, the institutional determinant has a very limited impact on the practices. It's more the personal determinant and the student-related determinants, the relationship with the family. Of course, it's totally different for nurses and doctors. For whom the institutional determinant is prominent. So just to conclude this part, we really need to have in mind that moving forward in the field of inclusion and equity for children and young people with chronic diseases, we need to do that with the teachers and contribute to a renewal of the professional identity. And this is capacity building, this is working condition and remuneration. But I would like to say that for me, capacity building is the priority and the role of a healthcare professional is absolutely decisive. Of course, we need not only to say, you have to do more, because all the teachers on the planet have a very heavy workload on their shoulders. What we have to do is to contribute to reorient their professional identity in order to make things coherent and not only a kind of accumulation of layers. I would like just now to conclude with a focus on the healthcare professionals and their role in schools. You know, it's not so easy. Well, imagine you're a GP, imagine you're a pharmacist. What could be your role? In some cases, the idea is that I'm a healthcare professional. I'm going to explain the teachers and the headmaster what they have to do with this kid with type 1 diabetes or juvenile arthritis. It doesn't work, of course, because it's a question of educational professionality. It's not a question of medical approach. And you know, when we work with the professionals, we always have to say, okay, take a seat. We are talking about children and young people that sometimes are your patients, but sometimes they are students. Children and young people, patients, students. How could we create coherence? It's not by saying, we're going to show you. It's not only by being too humble and say, oh my God, we are just a drop. We have no impact. No, not at all. The role of the healthcare professionals is absolutely critical from my point of view in all the different countries. This is to be catalysts of change. What does it mean being catalyst of change? it is showing that our professionals, healthcare professionals, are valuing what happens in schools and are making clear that schools are absolutely critical for the health of people. Don't forget the population trust in healthcare professionals when it's question of health, and their role and the contribution to value and to show the importance of what happens in schools is really important. Of course, first of all, to support the schools in the inclusion of children and young people, and especially during the COVID-19 crisis. This is also contributing to the recognition of the school contribution to health. And this is during consultation in the pharmacy and everywhere, just to include questions with parents and with the children, with young people. What happened in schools? How does it work? What did you learn? In order really to change the views of the school. Of course, it's not easy. This is also to reframe the interventions. Very often, this is more kind of lectures. How could we move it to something like capacity building for the school staff? Because if you want to educate, it's better to have educators. If you want to cure somebody, it's better to have healthcare professionals. All that things are linked, but we have the priority is probably to strengthen and to give more legitimacy to the education professionals by capacity building, building their motivation, contributing to, for example, the implementation in schools of the COVID-19 measures. Thank you so much. I just shared the ideas of the UNESCO Chair and WHO Collaborating Center, a framework on the return of the children with NCDs in schools, what we know from the field, the importance of using the glasses of schools, the levers for change, intersectorality, participation, capacity building, and the key role as a catalyst of change of the healthcare professionals. Thank you so much for listening.
I believe now we're moving on to the panel presentation.
Hello, everyone. It's my pleasure to be the moderator on this panel in order to discuss the strategies for educational continuity and management of NCDs during the COVID-19 pandemic. I have some really insightful and thoughtful reflections on Professor Jordan's presentation, and I'm looking forward for our next speakers to see their perspective so we could build a discussion towards the end. So it's my great pleasure to invite our first panelist, Sean Slade, Senior Director, Global Outreach, ASCD USA. Sean Slade is a Senior Director, Global Outreach at AACD, where he leads the promotion and expansions of ACD's whole child approach and mission. During his 3 decades in education, spanning 5 countries and 4 continents, he has spoken and written extensively on topics related to the whole child, health, well-being, school climate, and the promotion of ecosystemic approach to educational systems reform. He's a member of the OECD Future of Education 2030, UNESCO Chair on Global Health and Education, and a NBC Today CEL expert, and lead the development of the whole school, whole community, and whole child model with CDC. Please, Sean, the floor is yours.
Thank you very much, Bruno. And thank you for that quick introduction. I'm going to make a statement in reference to what Didier was talking about for about 3 minutes. And I'd like to add, I think there's one additional lever of change that Didier hasn't mentioned, but is surrounding all of us. And that is, in fact, the year 2020 and the COVID pandemic. Because I see this year and the pandemic actually being a lever of change to make us rethink how the sectors interact, and also how education, and I come from an education association, how education starts to reframe its purpose. There are 3 things I want to touch on during this introductory statement. One is COVID is forcing us as educators to reassess what the true purpose of education is, and we're seeing these discussions occur around the world. The second, it's also making us reassess the collaboration that we're having across our communities. And thirdly, it's really putting front and center the idea that we need to have both health and education, especially, work in sync for the benefit of each child. There are a couple of points that are becoming clear through the year 2020 that surround these 3 areas. One is that we're seeing that well-being is being forced to the front of the education discussion. We're seeing, at least in the US, where ASCD is based, even though we are a global education, we're seeing that well-being is being the first discussion as schools start to reopen. Well-being for the students, but also well-being for the staff. It's really what we are calling a Maslow before Bloom moment. What we mean by that is it's putting Maslow's hierarchy, ensuring that everybody is healthy and safe before we start to worry about Bloom's taxonomy, worrying about if we are developing the student's cognitive ability. Educators and parents and health professionals are understanding that the health and well-being of students is foundational. And by health and well-being, we're not only talking about the physical health, we're also talking about the social and emotional well-being of students. What I am seeing as well in the education community is an understanding or a re-understanding that focusing on well-being is good pedagogy. It's good teaching and learning. So previously, when we had the understanding that pedagogy was over here and a focus on health and safety was over here, we are seeing these conversations align. Health and well-being is good pedagogy. The second thing that we're seeing is an interconnection or an understanding of the interconnectedness. Not only are we seeing that we're interconnected globally, and what affects one country is now affecting the world, or what is affecting one city is now affecting other cities, but we're also seeing how the way that we interact at a local level is a strong determinant of how schools and how students will develop. We are seeing the need for people to dialogue, just as Didier was talking about. We are seeing the need for people to come together, whether it's parents and communities, health professionals, education support professionals, principals and teachers, to determine what's right as schools start to reopen. Unfortunately, what we're also seeing is that many of the gaps in our communities are actually exacerbating the issues. So we're seeing that when our communities don't have connection, or don't have support services, or don't have health services, or don't have school counselors, that those students are the ones that are suffering the most. And so it's really bringing this to the fore. And it's often our underserved communities who are suffering the most. A phrase that we've seen come up time and time again is that the gaps in our communities are being shown to be chasms. Those are not small gaps, they are becoming larger gaps. So in summary, what we are seeing from the education community and what we are seeing across not only the US and Latin America, but around the world, is there is a need to collaborate. We have done this at ASCD, as was mentioned, in conjunction with CDC, via a model that we released 5 years ago called Whole School, Whole Community, Whole Child, which is now the preeminent model in the US for aligning health and education. But to finish up, I just want to go back to COVID, and this year, whilst it is terrible and whilst it is traumatic, this is our moment of change. This is a lever that we can utilize to reframe what education is doing and reframe how the sectors are working together. So, do we want to go back to the normal that used to be, which was a system or systems based on inequity and antiquities? Or do we want to reframe the way that education and health and our communities work together? I'm going to end it there, and I think we're going to hear from the other panelists as well about how they are actually taking this alignment and bringing it to fruition in their regions. Thank you, Bruno.
Thank you very much, Sean. As Didier said previously, we are not facing a pandemic. We are facing a syndemic, and just like working through a systemic environment, we'll be able to face the challenge. I love the approach of whole school, whole community, and whole child. And I totally believe that prior focusing on educating, we need to focus on promoting a healthy and safe environment on social and emotional well-being. And that includes especially the education professionals who are often underpaid and underestimated. So thank you very much. Now it's my great pleasure to invite our next panelist, Dr. Carlos Alonso Rivera, who is the Vice President of ALEP. Dr. Carlos is a pediatrician with a specialty on neurology. He carries a master's degree in education with a specialty in communication. He's the former president of the National Confederation of Pediatrics in Mexico, CONAPEME. He's a member of Mexican Council of Neurology and the vice president of Latin America Pediatric Association, ALEP. He's a founder professor of the training program in pediatric neurology in the Hospital Central, Dr. Ignacio Morenes Prieto, and USALESP. He's the teaching director and research in the Hospital Central, Ignacio Morenos Prieto, between 2003-2015, and he's works currently as a private neurology pediatrician. Please, Dr. Carlos, the floor is yours.
Okay, thank you very much, Bruno. And now I'm going to speak in Spanish as well for all of you. Muchas gracias a todos por la...
Thank you, everybody, for this, for the invitation. And I would like to share my appreciation for all the professionals who are sharing your experience. We're all interested and involved in the well-being and health of children in our countries. Particularly, I am going to speak about the experience of Mexico. And I do believe that to some degree it is replicated in other countries of Latin America. As a physician, from a health point of view, there's many things that are worrying us during these very particular times. We are living through times that are totally atypical, as we have heard on repeated occasions throughout the year. It has been an important challenge, particularly now that we're focusing on schools, health, and education. It has been an important challenge because it has transformed society in terms of workspaces, social spaces, family spaces, and this is something that we have not had in the recent history of the world. Education in particular, normally we see it in a context that is separated, unique, and we give it a lot of value, but health is something that we consider to be related as a greater good, as one of the institutional rights in the majority of countries. However, in practice, there have been a great deal of challenges in recent years. In the past years, it's been seen that us physicians, we always try to promote prevention rather than this is important to deal with prevention from early phases, children and youth. These are change factors, and we have no doubt about that. If we educate this generation, work with them, speak to them, of course, they're going to be factors of change in the upcoming years, and we must never forget this during these circumstances. The non-communicable diseases have really been a departure point in recent years to focus on this, not only in schools, but also in terms of our medical experiences. The majority of medical societies and associations, we group this in Mexico as well in the rest of Latin America. We always have the habit of having these update meetings several times during the year. Well, in the pandemic, we've had to modify our educational structures. And now, like this event, we're always working on a virtual or distance basis, and we're distance education. It's not all been bad, but one of the themes that has worried us the most, and we have created workshops in the medical field, is also with respect to non-communicable diseases, particularly about matters that have been brought to the forefront yesterday and today that have to do with education in terms of nutrition, childhood obesity. It's sad to see how some years ago, when we were trained as physicians, particularly as pediatricians, we saw that nutrition in childhood was a challenge in poor countries. And I would say today it's a paradox, because now we have high rates of childhood obesity, and this affects the metabolic syndrome, poor quality of life, diabetes, and now we have to work with institutions. And also in terms, it's easy to say on paper and in theory, but in practice, it's very difficult to work, just as Professor Jourdan mentioned, to work in a coherent way in order to join our forces. I do think that one of the aspects that we have to continue in order to improve in the area of education is the participation of parents. particularly in childhood health. It is very little focused at the heart of the family. But when we get to school, it's like we just kind of pass the baton to the teachers, and we lose somewhat the communication. We have to, the responsibility of the health, we say, oh, that's the school's responsibility. And when you go home, oh, it's the responsibility of the home. But there's not enough of a link between the family and the educational, the schools, and we have to work on that link. We're going to need to work a lot on our interaction in order to generate a commitment in the different organizational structures like this, with this common objective, which is childhood well-being. We need to do this amongst medical associations, health authorities, and the educational authorities. It can't just remain in dialogue, but we have to create mechanisms in which we can take on our co-responsibility for childhood and adolescent health in our regions. Now, there's many challenges that we have to deal with, and one of the main challenges in order to implement these measures, without a doubt, is the inequity or inequality social. And all of this can be implemented, and we will be discussing it for sure in the questions and answers, how to generate or implement concrete strategies now that children are returning to school. However, it's very different when we speak about a university or private school that is in urban areas in which all of the requirements that are going to have to meet in order to be implemented in terms of training, hygiene, all of that, we can implement it. But when we are speaking about public education, generally speaking, it is very difficult to implement it. There are places, there can be 40 children in one schoolroom without ventilation, without the basic measures, and this is going to represent a greater challenge. And I share the following. And
we have to learn from this every day, but we have forgotten and we have left aside many illnesses that are important. For example, illnesses having to do with the psychological side, mental health, learning problems, troubles that have to do with conditions of anxiety and depression we see in kids. Accident prevention. So all the ENTs and all these problems are a very big challenge towards the future, and we must work on it. I would finally want to share with you the experience of our medical societies. When we have face-to-face events, before this tragedy of COVID, we could have 4,000, 5,000 pediatricians training together. And we always had the commitment to be in solidarity with society. And we would generate, together with the training for physicians, educational activities for teachers, for parents and family members of children and youth suffering from NCDs, and this has been a very satisfactory experience. I think that this is an important point. We have to create workshops that are given by experts in some way, but the target should be parents, educators, and people that are involved in this age group. This creates an experience and a commitment to collaboration. So no doubt we have many challenges, the main one being how to know when we can come back to school safely. In my country, we've been having 10 months with kids not going to school, and no doubt this will continue for at least 6 months. We're on the third wave of the pandemic. Mortality is high, contagion rates are high, and we're going to have to learn about the long-term consequences of these conditions and the control at home. Thank you once again for having invited me to participate. I'm sure we'll have lots to talk about during our panel discussion. Thank you very much.
Interesting point on which how to implement all these measures in the public system. And I'd like to bring this for our discussion, but just to keep in mind, 30% of the Brazilian population doesn't have access to internet. So how can we promote remote education, virtual education, if we are talking about that a considerable percentage of people that wouldn't be able to attend homeschooling, virtual schooling. So I think this is a really important point that we should keep in mind. So now it's my pleasure to call Ms. Mary Green Delaney, who is the Regional Advisor, Education for Health and Wellbeing, UNESCO Regional Office for Education in Latin America and the Caribbean. Please, Mary Green, it's my pleasure to invite you.
Thanks, Bruno. Bueno, empiezo con agradecer la invitación.
Well, I would like to start by thanking the invitation by SICKIDS. It's been a pleasure to listen Professor Didier, UNESCO's chair. Good afternoon, good morning, good evening to all the panelists. And well, what a pleasure to be here with all of you. That's a very important point, Bruno, access to the internet. And I would also like to link that with a point mentioned by the professor concerning inclusion, given that it has been and still is a very big challenge that we have seen during this year. I think it's the first time that we see it in all its dimensions, since we have insisted so much on virtual education or on distance education. And I think that now we all realize the incredible challenges we have as far as connectivity issues go. Now, in general terms, I think that just like Dr. Alonso and Dr. Slade mentioned, well, we have opportunities that the tragedy gives us, and that means at the same time that we have an enormous responsibility, and the next normal can't be the same or worse than the previous normal. So as far as education goes, health education, or the windows that are being opened to us at the present time, I think we have the obligation to think, rethink, and reinvent both the content of what we prioritize in education and in health education, the spirit of things, the goals, the spaces, and the time that we give during the school day to all of that, and all the innovations we have seen this year and during previous years as well to improve the promotion and the impact of all this. So I think that this gives us the opportunity to go far beyond prevention. Of course, this crisis has insisted on prevention of the transmission and hygiene, things such as washing hands, clean water, using a mask. But I think that we must as well enlarge what we understand, as Sean said, and go from health to well-being. And that's very important. And that is why I like so much the inclusion of those concepts in a direct manner during this conversation: inclusion and citizenship. There's a very big challenge, right, in putting together the education and the health sectors, the health services sometimes. And that is reflected in the typical prevention education that in many contexts is given in the school environment, preventing drug consumption, preventing non-planned pregnancies, preventing accidents, etc. And the prevention framework and the increase in risk perception is very well established, but we also know that this approach is not always very efficient nor long-lasting. And that depends on the program and the way the program is implemented. And I know that here we're mostly talking about prevention. That was the focus we had yesterday, the need to take good care of the needs of children and youth living with NCDs in the school environment. And of course, like Professor was saying, systems, human resources, the practices that are being created. But let's look at things with the lens of inclusion as well. We know that the health status in the education sector or the functioning of the education system is something that pushes in some way to exclusion, because if we ask any person living with a handicap, we know that such a person, for that person to participate in the educational process is quite limited if we compare that to a person that does not live with a handicap. We must learn from those experiences. Educational systems, and I think that this is a very big advance, we have started to analyze the impact of this systematic exclusion, both for indigenous groups, people who live in rural areas, race, sexual orientation, gender identity, a lot of factors that we know that each one of them can bring as a result exclusion, even with physical violence. But we also must approach these directly with policies, structures, systems, etc., that we have mentioned. So we must incorporate the NCDs in this group, right? Because many times we do not know why there are cases of bullying. We don't ask, is it because of his or her appearance or the clothes he or she was wearing or his or her race? We have to find out. So I think that we must better understand how attitudes and prejudices are formed both in children, youth, and in adults who work in the education sector to understand in depth whether we're talking emotional discrimination or whether this is something characteristic of the system itself. Now, as far as the citizenship concept goes, and I think that Sean approached this matter as well, I think that suddenly the world has realized, or maybe has internalized far more, the fact that health is something public, that it depends on one's behavior, and what is happening in the world affects directly the person. And I think that this is a very important moment. We also know that education is public and that what we learn or we do not learn in the educational process affects one and also affects the rest of our family, our friends, and our communities. So realizing that, and I'm coming back now to the idea that it gives us an important responsibility We must go from prevention and concern for oneself to a framework concerning caring for others, the responsibility of taking care of others, solidarity, charity, but also let's hope that this will take us to activism with a political spirit focused on those who have been excluded on a systematic manner, both in health and education, and that this will move us to change and to progress towards new and better normal. And I know that many of the participants are health workers who work in school environments. And I would only like to say that I believe that we must go beyond facilitating health services in school environments. And I know that many of us are involved in it. Rather, I think we should put together those two sectors that are very different from each other. In fact, these are different planets with frames of reference that even contradict each other, but we have a lot to learn from each other. From health that solves individual problems to education that has a long-term process that forms autonomous solidarity, targeting generations. And we have an intersection here between sectors where we must support both of them. So with these brief comments, it's been a pleasure to listen to my colleagues, panelists, a pleasure to be with you, and we'll see during our discussion whether we can go a bit deeper. So thank you very much, Bruno, and hello from Santiago.
Thank you very much, Mary Green. And you said something really powerful, that the next reality can't be worse than the previous one. And unfortunately, what we have seen so far, especially due to the social isolation, we are increasing the number of people who are sedentary. We are increasing the people who are more often consuming unhealthy food. We have seen the alcohol consumption increasing. So what I take from your experience is that we should think outside the box through innovative approaches in order to promote health and well-being. And as we seen, as we are experiencing right now, that unless health and education are treated as public issues, are treated as public goodies, we won't be able to change this really scary reality. So thank you very much. Now I'd like to invite our next and last panelist, Thomas Plaza Renances, who is a consultant in the health, nutrition and population global practice at the World Bank. He currently supports operations and analytical projects in Latin America and the Caribbean, with a focus on Central America. His main areas of interest are child and adolescent health, demography, and health equity. Prior to joining the bank, Thomas worked in the Inter-American Development Bank and their Organization of Cooperation and Economic Development, where he contributed to several publications. He holds a master's degree in population and development from London School of Economics. Please, Thomas, we are looking forward to hear from you.
Muchas gracias, Bruno.
Thank you very much, Bruno. I would like to thank all the participants and the panelists and Professor Jordan. It's a pleasure to be here with you all. I want to leave space for the conversation, and I only want to share a couple of ideas. The first one is that I want to underline the importance of intersectoral cooperation. And this is very related to resources. We have spoken about the fact that resources are limited, and this is one of the most limiting factors in this matter. If there's no balance in those intersectoral resources, it's very difficult to have an interdisciplinary focus. Sometimes it's just easier to have resources from one sector and not from all those who should be involved. So I would like to talk about human capital as a framework. That's the framework we have in the World Bank to be able to talk about education and health for human development. This has a very central role in school health. Human capital means that all humans have a potential they can reach if certain conditions are reached, right? Here we're talking health and education conditions, of course. This potential is not only important at the individual level of individual well-being, but it's also very important for the economy and the productivity of a country and of society in general. And it is also key for citizens that are active and that are committed with society, right? Now, in that sense, obviously, prevention and management of NCDs is something fundamental in this process. If we do not have this control during early years and in adolescence, then later on in life, it's very difficult to have an adequate quality of life. In that sense, I'd like to mention in the last minutes we have available that 4 of 10 children in Latin America and the Caribbean that are born today would not be able to reach their full potential as far as human capital goes. We do not know yet what the consequences of COVID-19 are concerning this matter, but we are certain that the impact will be negative and very important. Now, when we look at this impact long term, when we see the connection it has with productivity, I think it's very important to understand that we have to underline intersectorial investments and to invest in different sectors' resources to give them an important space in the agenda of governments and international entities. I would also like to say very fast that this matter of intersectorial cooperation has a very big impact on the fact that when youth leave the educational system, many times they don't connect directly to the health system, and they lose not only their connection to school, but also their connection to health. We have seen this at the global level during the pandemic, where really not only has a disconnection happened at the educational level, but also at the level of health. So in that sense, maybe the pandemic, we can see it as an opportunity to strengthen these methods to make sure that youth that leave the educational system, either because they just leave school or because they finished high school, that they shouldn't leave the health system and that they should keep those connections and the methods of prevention and management. This is very important for kids with NCDs. They leave school and they stop being controlled, and then years later, in many cases, they've developed their illness or they're in a more serious situation. Now, this vulnerability is not the same for all of the population, as we have said as well. Several sectors of the population are more vulnerable to suffer this loss of connection with the health and the educational systems. And we see, for example, that vulnerability to violence, to family fragmentation, the challenge of adolescent pregnancies that is very big and is very connected to the educational system. And in Latin America, Central America, the matter of migration is very important as well. We see many youth that abandon not only education, but they abandon their own country in many cases. And this, of course, breaks their connections with the prevention and management systems. So I would like to conclude with a call to action. We should use this opportunity and make sure not to arrive to a normal that is worse than the previous one. We should use the opportunities we have had to learn, to do health and education at a distance, not only for those who are in the educational system, but those who are outside. All of this with a whole school approach related to the health system. And I believe that this way we can increase the coverage and the quality of all services. I'll conclude with that. Thank you very much.
We are now moving for the Q&A session. Please, we kindly invite everyone to submit your question through the Q&A button on the top of the Zoom bar. We have heard some really powerful and strong sentence and words, but now moving into practice, I have a question to that I'd like that the four panelists could answer. I would give you 2 minutes each, so please be concise so you can ask more questions from the ground. So the question is, and we could start from you, Tomás, if you don't mind. How can healthcare professions concretely support capacity building in school and programs aiming at educational success of students who live with NCDs? 2 minutes.
Yes, it seems to me a very good question. There are many opportunities to cooperate in that sense. And maybe a message we could transmit is that this coordination mentioned previously is where the basis should be. We can, of course, wait for professionals at the individual level to go beyond their time and their resources and to contribute to those learnings, to those exchanges, but there must be resources, of course. There must be investment in these matters, in these mechanisms of sharing ideas and knowledge. I would also like to emphasize what I said earlier concerning leaving the health system and the interaction between the health and educational systems. I think that Professor Jourdan mentioned it as well. It's fundamental. Health must include a reference to the educational system, and there has to be a synergy in this matter. There must be a duality of attention. Thank you.
Mary Gwynn, please.
Thank you.
Thank you. I think there's a number of issues that we can focus on to avoid this worse new normal in general, in addition to the points that Tomás just mentioned. Perdón, estoy hablando inglés.
I apologize. I was talking English. I think that as I mentioned previously, one of the most important things that we can and that we must do is maybe not to put together all the children with NCDs in one single bag. I think that each child with that condition, and sometimes more than one child, need to get very specific care, and they have specific challenges. And if we identify those well and we develop that capacity in the education sector, reflected in policies, systems, documentation of best practices, then we can advance as well in the strengthening of a wholesome response of the system.
Thank you very much. Dr. Carlos?
Sí, creo que aquí
Yes, I think that here the question is focused around a concrete strategy that we could apply in order to use it in this context. Something that would make things a bit easier is to remember that education is cyclical. There's cycles that start and end once a year, and that facilitates a little bit making a strategic planning. And there's two opportunities here. First, to make a situational diagnosis, identify statistics and problems I have at school, because sometimes that is diluted a bit, and it would be important to know as an educational authority in my school, what is my situation, my real situation as far as NCDs goes? What percentage of the children I have at the moment are potentially susceptible to have a problem of this type? The second thing is the approach of looking for agreements. The situations of medical national societies, this is not very well used in education. Many societies have financing from big pharma, from different means, and this could be invested in education, in training. We should look for concrete agreements between schools and medical local associations. This could help not only for it to be, well, I'll give you my time when I don't have something else to do, but rather I'm committed with you. I'll go once a month. I'm going to train your teachers in this concrete theme to then be able to create an experience of collaboration that is more adequate and with better results.
Muchas gracias. Sean,
Thank you very much.
Lo siento, ma il mio español es muy mal, so I'm going to respond
I'm sorry, my
in English.
Spanish is really bad.
I agree with Carlos. I think this is an opportunity. And again, where I come from in my talks, I'm talking about how we try and transform the systems. This is an opportunity for health professionals to come to the table and show education the value of what they can do. So this is the time and this is the moment where health professionals can be there, insist that they are in dialogue and in discussion with education leaders to make sure and to showcase that health needs to be part of the system. Health too often has been relegated by education leaders as a secondary or tertiary thing to worry about. Take this opportunity, be at the table, make sure that they see the value of health in the schools and in the community. So take advantage of this time.
Thank you very much. We have one more question from me, and then I'll pass the word for Ideli Palazuelos, who is a youth leader and member of the Federation of Medical Students from Bolivia, who will ask a question from the attendees. So we can start with you, Sean. What barriers and enablers are there in the school environment for teachers and health professionals to meet the needs of children and youth living with NCDs? Once we are talking about cooperation, and we understood that both professionals or group of professionals, healthcare and education, what are the barriers and the enablers to move forward?
I again see the barriers and the enablers being almost the same thing. And I think we are coming to a realization this year that we have the same understanding of what the purpose of education is. The barrier that's been there for educators to allow health professionals in and to make adjustments around NCDs is the fact that educators has seen their role as being only about academic development. What we're starting to see now is a wider discussion that school is there not just to develop and teach academics, but school and education is there to help the development of the whole child, the whole person. So it's their development socially, emotionally, mentally, physically, as well as cognitively. So that has been the barrier that has stopped this integration. And I believe that this moment in time is allowing us to reframe that discussion around the purpose of education. And via that rediscussion, it allows health professionals to come in to fill in many of those gaps and to support the educators as they're starting to promote the healthy growth, the healthy social emotional development of our youth.
Thank you. Dr. Carlos?
Hay muchas barreras que
There
podemos.
are a lot of barriers that we can identify. I think that the main barrier is that we are not clear about what our role is. We're not clear about what moment it is the responsibility of the institutions or of the authorities. I feel that we've spoken a lot over these 2 days about collaboration, coherence, working together, but once again, there's a lot on paper, but now we have to really, we understand that this work is very difficult, and I know that it's an opportunity. We have learned this year how to live in a different way. And we have to be co-responsible for this. The governmental systems, that's a fact. They don't have the capacity in order to handle or manage this in the right way. So the participation of society and the different organizations of the public and private sector have to learn to work together, something that we have not done up to now, in my opinion. Thank you.
Gracias, Bruno, y de acuerdo con la observación de...
Thank you, Bruno. And with the observation of Dr. Alfonso, what is written on paper and the good intentions and the structural limitations that exist in terms of collaboration. However, I want to differ somewhat with what I understood in terms of what Sean stated. I understood that he was stating, and maybe I'm wrong about this, but he's saying that the attitude of the educational system faced with the health sector is the barrier. And if they would just let them come in and do their work, that would open more collaboration. But I think that we especially have to take into account that in Latin America, the medical sector, doctors in general have power, a social power that is greater than a teacher in a rural zone at a school of basic education. For example, I believe that this power, this social power in general, implies that many professors, even if they are the ones, of course they're going to take charge of the academic part, but they know how children and youth learn. They know how to teach. And it's not necessarily the strength of a physician, maybe a nurse more, because they are more within the practice of educational activities. But we have to take this into account. It's not just for the doors to be open from the schools so that they can come and give their chats or dental services, vaccines, or school nutrition, but they have to be integrated within the fabric of the educational community in terms of everything that is done in a day, converting that into lunchtime, which is a very protected space, making it into a moment of learning about good nutrition, not just a chat from someone who comes from outside who tells them you have to eat well, because we have to prevent obesity. In other words, it's something that is a lot deeper, based on mutual respect of knowledge and the roles of each sector. And that is built with dialogue. And I believe that the educational sector, how shall I say it? Sometimes they raise their hands. I believe, oh, well, you say because you know. And rather than having that, let's work together to take advantage of these spaces and these years, these protected years, almost guaranteed, of many children. And in this well-structured environment. Maybe I didn't fully understand you, but I believe that it's an interesting conversation that we could have.
Thank you very much. Now I'd like to pass to Italy, who will ask some questions from the attendees. Please, Italy.
Gracias, Bruno.
Oh, thank you, Bruno. We have received a question from Liliana from the Asociación Cuidar from Argentina. The question is for Mr. Jordan, Professor Jordan, who says many times, the lack of knowledge about certain frameworks that have to do with this. There are there's always thinking about legal structures that what would happen if I say something that is out of place, if I'm not allowed to speak of these aspects. So how could I do that? How would I be able to speak about that?
Dr. Jordan has already left the call.
Oh, Dr. Jordan ha dejado él ya respondió a Liliana, lo voy a leer, es crítico, particularmente para niños con diabetes de tipo 1. Hay que avanzar en la manera en la...
I see 3 levels. The legal one, laws have to describe the condition for teachers and children themselves to use medicines in school. The institutional one, management plans. And the question of capacity building of school professionals. The negotiation with the unions, the strengthening of intersectoral work, the training of educational professionals are key enablers. The next question, please, Ideli. La próxima pergunta, por favor.
Next question, please, Ideli.
Hay una pregunta en el chat.
There is a question in the chat, which I'm going to say very quickly, about the interprofessional activities to create better synergy between disciplines.
Could you please answer that in 1 minute so I can wrap it up, please? do you want me to, Sean, did you understand the question, or you want me to read? Okay, I will read in English. Do you consider that interprofessional education might be the strategy to foster synergy and better dialogues between disciplines?
Certainly, I think the more that we can start, even during teacher education training and health training, educate people who are coming into the professions on how they can work together, it sets us off on the right course. To go back as well to what Mary Gwynn was stating, I strongly believe that it takes a village to raise children. It takes a community working together intersectorially to help raise our children.
Thank you very much for all the panelists and for all the attendees. It was a pleasure sharing this moment with you. I was actually on my closing remarks just to quote the Nigerian proverb that you just said, Sean. So I think we are pretty much aligned on building an environmental and a system that we are able to put our kids and our youth in center. It's important to keep in mind that we need to beat the NCDs and prevent the NCDs, but we cannot forget those who are already living with them. Last but not least, I would like to invite you all to join the movement of Aliança Juvenil and follow us on Facebook. Our handle is Aliança Juvenil, and on Twitter and Instagram is _Aliança Juvenil. As more people join the movement, the stronger we'll get, and the louder the voice of the youth in the Latin American and Caribbean region will be heard. Thank you very much. I pass the word to you, Marie.
Thank you so much, Bruno, for the excellent moderation, and thank you everyone, all of you speakers and attendees for being here today, and thanks to the speakers particularly for the important reflections that you have given us all and shared with us. The new insights and opportunities to this region in regards to school health and management of NCDs are very clear to us all, I believe. It's been a real pleasure to hear from you and to learn from your diverse backgrounds and perspectives. And also, I think what has been really special today is how we've managed to bring health and education experts together. And the reason why that is so needed is really when we look at the child, and especially the child living with an NCD, in addition to the family, those in education and in health are some of the very most important people to these children. So I hope as a silver lining to COVID, that combined with this event here today, it might just be what we need to really move things forward and create real positive change for children and young people living with, whether it's mental health disorders, childhood obesity, diabetes, cancer, or other NCDs. That is what we hope in NCD Child, and we also hope to work more with you in the future to really take on this challenge and this agenda in the region. So thanks again, and now let's move on to the breakout sessions. You should all have received an email from a workshop planner, which has a link to join the discussions. And we can now leave this Zoom call and then move into that. So we look forward to seeing you all there and the interactive part of this workshop. Thank you so much, and bye.